In Milwaukee, we are getting a closer look at what reopening schools during the pandemic will look like, as students en masse receive temperature checks before entering the classrooms spaced apart, and lunches served outside the cafeteria. With West Virginia schools slated to open on September 8th and Virginia schools falling closely on the 9th, the pressure is being applied to many superintendents across the two Virginias.
If students want to come to their schools with a teacher in person, they will be allowed.
Parents, grandparents, and legal guardians are left with what they thought would never be the toughest decision for their children, and that is sending them back to school.
My decision would be for her not to go, but her decision, I've left it up to her. With her being a senior, she's kind of, as of now, leaning toward going back.
I want my kids to be safe, but at the same time, I know it's important for them to get back to school. I feel like they do better in-person learning. The virtual stuff was not easy for us when school ended last year.
Dr. Nancy Lohays with the Princeton Community Hospital is giving us a closer look at what a case of COVID-19 should look like in our schools. Her presentation begins with a student or teacher showing symptoms of being sick. They are quickly sent home and assessed by their healthcare provider, while other exposed students, teachers, and extended family all isolate as much as possible.
Once that kid is tested for flu and strep and other viruses and is negative, then it's just a virus that's causing it. So they can go back into the school after they don't have a fever for 24 hours. But if that child actually has COVID-19, then the public health department is notified and the contact tracing or notification and quarantine starts.
This is why Dr. Lohays says putting students and teachers into smaller groups this year is vital.
There is some evidence that if we can cohort children, meaning putting children in smaller groups such that there is exposure only to each other and to a certain teacher, that perhaps if there is a positive COVID-19 case, that it will be much easier to isolate that small group and that teacher rather than having to send the whole school or the whole county home.
Being exposed to a positive case includes being within 6 feet of the positive case or exposed to the positive case for more than 15 minutes. But there is actually a big difference between quarantining and testing positive for the virus.
When you are quarantined because you had a contact, you are likely asymptomatic or pre-symptomatic, meaning that you don't have any signs or symptoms of the disease at this point. But you could become positive for the disease or symptomatic at any time during that 14 days.
As awful as it sounds, children who test positive for COVID-19 should isolate from their extended family, but exposed extended family should quarantine for 14 days. There's still a lot of speculation amongst the governors on if reopening dates for schools will be postponed, but it all depends on how COVID-19 cases trend over the upcoming weeks. Here for you, Brandon Lawson, WVVA News. In Tazewell County, bells ring in the new school year as some students in Virginia report for their first day of school during the pandemic. But across state lines in West Virginia, the new school year starts September 8th.
I think that parents have a horrible situation right now.
The situation is a choice between virtual and in-person attendance.
I've left it up to her. With her being a senior,
It's a tougher decision for parents of younger students.
There's just a lot of logistics with going back to school for younger children that are difficult. It's difficult to understand social distancing. It's hard to make younger children wear a mask.
Before your children put on their backpacks and walk through the double doors at school during this pandemic, Dr. Nancy Lohays with the Princeton Community Hospital is sharing 10 tips that every legal guardian should have on their refrigerator this school year.
Make taking their temperature a part of their routine for every day, just before breakfast. Find out if their temperature is less than 100.2. Second thing is check for symptoms. On the CDC website, there is a list of about 10 symptoms. And while your child's having breakfast, just go through the list and make sure that they don't have any of those signs or symptoms.
Other advice: fight the virus on all fronts, including clean clothes and hand sanitizer. Teach your children how to properly wear a mask. Don't assume they know how to put the mask on and take it off. Emphasize touching the outside of the mask will spread germs. This glitter is an excellent visual to get the point across in a way they'll understand. Try to change old greeting habits. When they see their friends, elbow bumps instead of handshakes, high fives, and hugs.
It's important to practice social distancing when you're at home with them. So before you send them to school, when you're with a family member, maybe have the family member show that it's important for them not to be able to reach out and touch the person next to them.
While most know sharing is caring, but even social graces need social distancing this year.
Maybe when they want to share something with a fellow friend or somebody at school, instead of giving that to the other person, maybe just turning it to them and showing them, especially with phones and iPads and computers, just turn it around so that the other person can see rather than actually handing it to them.
School system staff must be the best role models.
They have to set the example. They have to wear their masks. They have to stay far apart from each other. They have to show the children how to do things correctly.
And as your children exit school for the day, it is important that when they get home, you sanitize their hands and their belongings. Dr. Lohades has also brought up a good point that you might want to move the shower to just after school hours this year, mainly because after messing around with all the germs, they get a shower and get clean right after the school day. Another thing that's really good news, though, out of all this is that children are normally asymptomatic when it comes down to the COVID-19 virus. It's the parents, grandparents, legal guardians, and at-risk adults that we have to take strong care of this year. There's still a lot of questions and concerns that loom over what could be the hardest school year in modern history. Here for you, I'm Brandon Lawson, WVVA News.